Good morning, all. Can everybody hear well? All right. I'm Jason Stevenson from the Utah Health Policy Project. I work as the Education and Communications Director. Just want to give you a little bit of background about UHPP, which is what we call ourselves before we begin. We're a nonpartisan, nonprofit organization. We've been around since about 2006, and we work on all aspects of healthcare reform. But for the past couple of years, it's really been on two issues. The first is Medicaid expansion, which Riley will discuss in just a little bit. And the second is making sure the Affordable Care Act, otherwise known as Obamacare, comes to a soft landing here in Utah, really trying to make it work for our state and for our people. And that's been one of our major roles. So be glad to answer some questions after both of us are done. We've got a question slides as well as our contact info. But we're going to get right to it. And there's a handout going out which actually has one of the more complicated or important slides, because we realize it's not easy to see in this bright church, all of the contrast up there. So the handouts will hopefully illustrate some of the issues we'll discuss. Well, first, I wanted to talk about what the Affordable Care Act or what Obamacare is, because there's still a lot of confusion. There's still a lot of misconceptions. You might get those emails from your crazy uncle, those chain emails, which tell you exactly what it is, and you're pretty sure that's not it. But this is the best definition that we've been able to come up with over the past 3 years. The Affordable Care Act, or Obamacare insurance, is private insurance plans sold on healthcare.gov with premiums subsidized for some people. That's like the cat in the hat version of Obamacare right there. Fewest words, simplest definition, and it's actually pretty accurate. A lot of people think that Obamacare is public insurance. A lot of people have no idea about the subsidies and what they do, and we'll discuss exactly what those are as we go through, and of course, be able to give you some questions or some ideas of what might be in the future as well. But let me give you a template about where we are at the moment. Right now, we have 128,000 Utahns enrolled on ACA insurance. This is as of the end of March. We're up to 140,000, but then we sort of looked at who actually had paid their premiums for the first couple of months, and it dropped down to about 128, so a slight decline. And that's a pretty good number. That is 128,000 people who don't get insurance through their employer, aren't on Medicare or Medicaid, because those three things make you ineligible to sign up for the ACA. These are people who need to go out and buy insurance on their own. I used to be a freelance writer. No one was actually, paying for my insurance. No one was helping me get it. I had to go out and get it on my own, and that's where the Affordable Care Act insurance comes in. Maybe you're an entrepreneur. You're starting up your own company. You leave a job. You lose your job-based insurance. COBRA's too expensive. Well, the Affordable Care Act insurance can step in to make sure your family is insured while you get that business set up. So that's really who is on this kind of insurance, and we have over 128,000 Utahns and growing who are taking advantage of that. So those are pretty good numbers. It actually puts us in the top quartile of states in terms of the penetration or the number of people that have signed up, which many people probably wouldn't realize that Utah would be there. Now here's what's happened in Utah since all those people signed up. Our uninsured rate has dropped 15%. It's gone 15%, so it's gone from 15 percentage points down to 13, where nationally it's actually dropped 20%. And this is based on a Kaiser survey, a phone survey that was done earlier this year. We'll get some really good data from the Department of Health in September, which is a much more accurate survey, but we expect to see that same decline, a dramatic decline. The only time this has ever gone down this much was in the 1960s when Medicare and Medicaid were passed. That's the last time we saw such a dramatic decrease in the uninsured rate. In some states like Arkansas and Kentucky, which have both embraced the Affordable Care Act and Medicaid expansion, have seen their uninsured rate drop 50% in 1 year, which is just unheard of. I mean, rarely can you get a public policy program to have that kind of impact that quickly. So where are people signing up in Utah? This might surprise you. The #1 zip code for ACA enrollment is Daybreak in South Jordan. #2, Lehigh. And I keep telling Representative Jake Anderegg that his city is like #2 for Obamacare. He just won't believe me. But the facts are there. That's what it says, St. George, American Fork. You'll notice something. 7 out of the top 10 zip codes are outside of Salt Lake County. Back in 2014, 7 out of the top 10 zip codes were in Salt Lake County. And this is 2015 data. So we've seen this dramatic shift in terms of who's signing up. The momentum is moving to Washington County, Davis County, Tooele County, and especially Utah County. People love Obamacare in Utah County. They're just not telling anybody about it. They're signing up at 2 a.m. and no one's watching, but they're enrolled. And there's a couple other things that let us know that this is a very successful program in some of the more conservative areas of the state, simply because health insurance shouldn't be political. It shouldn't be something that it's a litmus test of what party you belong to. It's about taking care of your family, and fortunately, many people are realizing that. Here's how those subsidies work. You actually see the slide there in front of you, which has the Shumway family on it. It's on one side of the paper that Riley just handed out. A lot of people don't know how these subsidies work. These subsidies that were actually saved by the Supreme Court decision that we just had at the end of June, which could have wiped them out in Utah and in 34 other states. So these subsidies work this way. Here we have the Shumway family, 24, 23, and they have a newborn. So that newborn enables them to sign up for insurance. And they don't get insurance through their jobs. They are maybe entrepreneurs, maybe running their own business, maybe they're doing commission sales. So they've got to buy insurance for themselves. So they're signing up for insurance for 3. They make about $44,000 a year. And that puts them at about 220% of the poverty level. So their child wouldn't qualify for Medicaid or CHIP, because the cutoff for those is, I think, 150% and 200% of poverty. So they've got to buy insurance for everyone in their family. Now, normally their premium would be $450 for all 3, and that's based on the age and the fact that they don't smoke and the fact that they live in American Fork. Those are the only 3 things that can determine what your premium is: age, smoking, and geographic location. The fact that, Mr. Shumway had a bad back doesn't matter anymore. The fact that maybe breast cancer runs in her family doesn't matter anymore. That's one of the most amazing things about the Affordable Care Act, is that your pre-existing health conditions are wiped away. It doesn't matter. It kept so many people from getting insurance, and no longer is that even one of the questions that is even considered when you sign up for insurance. It's age, geography, and smoking history. So their premium would be $450, but they get a subsidy of $189. Now that subsidy looks a lot like the subsidy that you would get if you had employer-based insurance. Those of you who have employer-based insurance know that oftentimes your employer creates a pre-tax contribution, either to an HSA or actually for your premium, that helps make your premiums more affordable. But when you buy insurance on your own, there's no employer out there doing that. There's no benevolent overlord that is helping you pay your insurance. So the subsidies step in to help make the playing field more even. They end up paying $261 for their insurance, which is a lot more affordable. They can put that into their budget. And it's insurance with a $2,500 deductible. A primary doctor is $25 to go see as a copay. Specialist is $50. Generic drugs are $10. That's pretty good insurance. And this isn't the best insurance. This isn't the worst insurance. This is, of the 100 plans that are for sale in Utah County, this is kind of right in the middle, sort of the median kind of plan. We call it the benchmark silver plan. So that is how the subsidies work. They make this insurance available for this family, where $450 probably would have broke their budget, but $261 is something that they can do. And let's say they get a raise, their income goes up to $52,000 a year, their subsidy would go down and the amount they pay would go up. Or vice versa, they lose some income, the subsidy would go up and the amount they pay would go down. So it fluctuates based on your income, which as a freelance writer, my income fluctuated quite a bit, let's just say, often moving from 0 to 0. So, this is a really helpful thing because you aren't just stuck with insurance you can't pay for. Your insurance stays affordable based on how your income changes. So very, very important aspect of the Affordable Care Act. So that's how it works. You can definitely see it also on the slide you have there. Now, we know a little bit more about people signing up for the ACA. 67% of them get subsidies. That number we think is actually higher. We think it's actually in the 80s, and we're having a little argument with the federal government about that, because we were at 88% for months and months and years in terms of the percentage of Utahns getting subsidies, and then in just the last month, it dropped to 67%, but nothing else changed. So we're not quite sure that number is correct. We're still trying to figure that out with them. But if it is correct, it's about 86,000 Utahns that have subsidies. If it's closer to 80 or 85%, it's over 100,000 Utahns that are receiving subsidies. So still a substantial number. And you can see the national rate is about 85% that get it. We think we're a little closer to the national rate because it really shouldn't have changed that much in the past month. But here's something else that's surprising. The Affordable Care Act is becoming children's insurance in Utah. And this is something that we're really trying to get out there. We have 22% of our ACA enrollees are under age 18 in Utah. Nationally, it's 8% are under age 18. So we're almost 3 times the national average of enrolling children in ACA insurance, which makes sense, right? We have a lot of kids in Utah. But you run it through a regression, you do some comparative analysis, and we're still well above what we should be, even based on Utah's larger family size and demographic shift towards younger population. So what we're realizing is, hey, where are people signing up for insurance? They're signing up in St. George, they're signing up in American Fork, they're signing up in Lehigh. What is the average family size in those communities? It's big. It's big. It's 6 kids, 5 kids. So when people sign up, they're bringing in lots of kids. And so this insurance is becoming family insurance and kids insurance here in Utah, which was something we really were trying to get out when the King v. Burwell decision was floating, because you would have been taking insurance away from over 30,000 kids in Utah if you would have taken away those subsidies. So ACA insurance is kids insurance in Utah, more so than in any other state in the country. It's pretty incredible. I just have 1 or 2 slides before I wrap up. And this is just sort of something to get you a little bit more situated of when can people sign up for insurance, when they can't sign up. This is sort of a new aspect of the Affordable Care Act. And that's because we have what's called open enrollment and special enrollment. You can see the "We Are Here" sign, kind of like a map in a shopping mall, making sure you know where you are. We are in a special enrollment period here in 2015, which means you can't actually go out and sign up for health insurance right now unless you have what's called a life qualifying event. Having a baby, losing your job, losing your insurance, moving, getting divorced and losing your insurance, things like that are called life qualifying events. They will enable you to sign up. But otherwise, if you don't have one of those, you have to wait towards the next open enrollment period, which starts November 1st and runs until January 31st, 2016. Basically, none of us are going to have really good Christmas and Hanukkahs forever because they put this open enrollment stuff right around the holidays. Really messes up all our stuff. But, it sort of also mimics when Medicare open enrollment is, so it's a good time to do it. So here's how it works. During special enrollment, if you get sick on Monday, you can't sign up for insurance on Tuesday unless you have one of those qualifying life events. And unfortunately, even being diagnosed with cancer isn't a qualifying life event. You've got to wait until the next open enrollment period, which would be November 1st. But during open enrollment, during those couple months of the green part of the chart, you get sick on Monday, you can sign up on Tuesday. There's no problem with that. There's no prohibition, there's no rules, the door is unlocked, you can go forward and sign up. And here's why insurance companies do that. You might think it's a little unfair. Why do they have open enrollment and special enrollment? Well, imagine if car insurance worked with open enrollment, like here. So you have an accident on Monday, you call up Geico on Tuesday, do you think they're going to cover your accident that you just had? They're not. And I just had a tree crush both of our cars, and believe me, we're glad we had insurance and they wouldn't have covered it if we didn't. So that's why it works that way. Health insurance, at least for the green part of the year, you get sick on Monday, you can get that illness covered during open enrollment. But during the rest of the year, the doors are locked. And that's because the insurance companies really want you to have insurance full year round. So no matter when you get sick, you've got insurance, that you're paying your premiums, and it's there for you when you need it. You just don't sign up for it as you get sick, because if car insurance worked that way or anything else worked that way, it would never be sustainable. Everyone would wait until they needed it, they'd sign up for it, use it, and then drop it, and these insurance companies would never be able to survive. So that's why we have special enrollment and open enrollment. And here's where you get help. If you or anybody you know has questions about the Affordable Care Act, we've got this neat group set up called Take Care Utah. We actually did it ourselves, along with the Community Health Clinic Association here in Utah and United Way of Salt Lake 211. It's a website, Take Care Utah, and it's a phone number, 211. You go to either one of those, you tell them your zip code or type in your zip code, you get a Google map, really fancy-dancy, with a lot of information about these 100-plus enrollment experts that we have spread over the state. And these are people who've been working for 2 years about signing people up. We've helped over 50,000 people sign up. We've had over 200,000 interactions with unique individuals, helping them get their questions answered and helping them sign up. And we really are the experts to navigate healthcare.gov, Medicaid, even a little bit of Medicare. We help people figure out what are the best options for them. And it's completely free. We're funded by a federal grant. We hope to get the funding for the next couple of years. And we are the folks on the ground here in Utah who answer those questions. So instead of calling up the federal 1-800 number, please don't do that. It's really bad. Call 211. It's a much easier number to remember. We're local. We understand Utah issues. We know how to pronounce Tooele. We know how to pronounce Hurricane. We're not based in a call center in Charlotte. We can do that, and we really are a useful group. We actually are now getting a lot of referrals from Senator Mike Lee's office, Chris Stewart's office, Orrin Hatch's office. We've met them. They're sending their questions to us because they realize that we're the people who actually fix those problems and get it done. Now, finally, just 3 questions I want to address before Riley takes over. And these are questions that have actually been bugging me. That's why I brought them up here. I don't normally bring these up during presentations because they're not normally Unitarians in the audience, but I figure you guys will appreciate this. first question is, why is the Affordable Care Act, or Obamacare, still viewed unfavorably by a majority of Americans? Those of us who work in this field and see how it helps people, go out and even talk to groups like you guys, often scratch our heads and wonder why the national polling puts the ACA at 35% favorable. You know, still after 5 years, 4 years, it's still never actually gotten above 50%. And that really puzzles us. And one thing we've realized is that the Affordable Care Act only helps about 10% of Americans. It's those 10% of Americans that are uninsured or buying insurance on their own or lose their job temporarily and are able to go get this insurance but then get another job that has insurance. And so it's just a small percentage of Americans that see these benefits. And it's everyone else who sees the negatives and think those negatives are caused by the Affordable Care Act. Their premiums go up, blame Obamacare. Their kid broke his arm, blame Obamacare. The doctor was rude to you and made you wait 2 hours, blame Obamacare. So it's very easy to blame something that has already been personified as this very evil thing if you don't see the benefits happening in your life. And that's one of the challenges, is that the number of people it's actually helped is small, but it's also a group that is constantly churning. So more and more people, you lose your job, you retire at 55 and you're waiting for Medicare, the Affordable Care Act can serve as a great place to get insurance. So more people are going to be affected by it, but it's still never going to be more than about 15% of the population. So that's one of the challenges of why it's never going to be maybe very popular. It just doesn't affect that many people. So who is benefiting from the Affordable Care Act? Now and in the future, it really just goes back to the answer to the first question. It's a slim percentage of Americans. It's those that buy insurance on their own, or all of a sudden have a life crisis, losing their job, divorcing, moving, something like that, where becoming uninsured is a real possibility. The Affordable Care Act is there as a stepping stone, as something to get them back or at least maintain their health. And we encounter a lot of people in our office who retire or lose their jobs in their 50s and are counting down the days until Medicare. And this has become a godsend for them because it enables them to keep their medications and keep their doctors, where normally in the past the pre-existing conditions and the cost of insurance based on age would have made them uninsurable. So we encounter a lot of folks in their 50s and 60s in our office. So those are people who can be benefiting. And the other thing we see is we see a lot of kids under age 26 who are still on their parents' insurance. That is a huge percentage of the young people in the state. When we do presentations at universities, it's a forest of hands that are still covered under their parents' insurance. And that's because of the Affordable Care Act. That was a provision that was made national back in 2010. The uninsured rate for actually 18 to 26-year-olds in Utah went from 29% in 2010 to 17% in 2011. So, and that was Department of Health numbers here in our state. So it had a big impact for that young group. So people benefit from the Affordable Care Act, but they tend to benefit from it in fits and starts and at specific points in their lives. And it's very few people, except for former freelance writers like myself, who actually need it for their continuous insurance. Because most people kind of come in and come out of it, and that's actually what we've seen from our talking to people who sign up. So it tends to be a bit of a episodic type insurance for many people, which again points to the first question of why many people still don't like it, is because there's very few people who are directly benefiting from it all the time. And this is the last question. I actually brought this up in a trip talk a couple weeks ago, which is, will the Affordable Care Act end up like the GI Bill, or will it end up like No Child Left Behind? Those are two federal programs which have vastly different connotations in our history and even in our psyche of what the federal government can do. The GI Bill was passed by a Democratic president with a Democratic Congress, right? No one really remembers that, though, back in the 1940s, do they? 1944, I think, is when it was passed. But everybody knows that about the Affordable Care Act. The GI Bill only affects a certain number of people. You have to be a returned service member to get the benefits from that. You have to have served your country. So not everybody benefits from it. Yet it's viewed as a public good because those people have sacrificed and done something. They should be able to continue their education and improve themselves. So we put public funding, federal funding, into helping them get an education. So the GI Bill actually has some similarities to the Affordable Care Act, but it doesn't have the same sort of connotation, the same sort of acceptance. And so would the Affordable Care Act eventually become like the GI Bill? It could. The Affordable Care Act, that kind of insurance, could just become private insurance just through another way, just like Medicare, Medicaid, employer-based insurance is the way that people get insurance. Or it could go the way of No Child Left Behind, which was passed by a Republican president with a Republican Congress, I think back in 2002, if I remember correctly. And it actually is almost gone right now. Just the last vestiges of it are being stripped away. And it was viewed as a vast federal overreach. Local people didn't like it. We didn't like the testing. It was something that had bipartisan antagonism. No one, a lot of people didn't like it. And it's kind of been disappeared. It's gone away. And it never really had, it had some good ideas perhaps. It had some good motives. But the way they put it together, it just never worked out. And it was eventually lost its support and was totally stripped away. So the Affordable Care Act could go that way as well. It could be repealed by a Republican president and a Republican Congress. That's less likely because of the 10 million or so folks who have insurance, but it still is something that could happen. So just some things to think about these different lifespans of federal legislation. The Affordable Care Act is still in its infancy. We don't know where it's going to go. Is it going to grow up to be the GI Bill, or is it going to grow up to be No Child Left Behind? So that's just what I want to leave you with. And now let me turn it over to Riley.